We have a whiteboard we use for communications, and although the names on this board are fictitious, this is very representative of how we would use the board in our everyday working environment here. First of all, today is Monday, and we have a heart. There's one platelet requested, so within the medical record number for the patient. Coming up on Wednesday, we have a patient who's been on Plavix, who needs 4 platelets, and we want them to be ordered on Tuesday, since that would tie up platelets too much to order them today. We have a patient here who is having a GI bleed, so we need to keep 4 units ahead. We have an IVO outpatient, which is an outpatient coming in for blood on Wednesday, who has 3 antibodies, so we have ordered the blood today, and it's coming tomorrow so we can set up the cross match. Somebody had a positive fetal screen, and we need to have a Kleihauer done, and since we don't do them here, we write it on the board so that whenever it's done, oftentimes next shift, so they know that it's to look for the answer in the computer. For our hearts, as they finish, later today we'll take down this and we'll put up the finished for them, so our evening staff will know who the heart was and that the surgery is finished. The other ways we will use this is we will write down here if we have students or new hires and leave QC for them to learn. We have thawed, fresh, frozen ready. We will then put the type, how many units, and the out date for them. And we also have for our alarm, if our refrigerator ever goes down, we have to check it every 4 hours. So we put up our little reminder here, and we put this into use then. So this is how we communicate in the blood bank.
How long have you been using the SBAR tool?
We've been using the SBAR a little over 2.5 months.
And why did you start using SBAR?
We had been seeing that there had been some communication issues that have been going on that could be benefited by using a simple communication tool.
Okay. Can you describe the tool that you use?
Yes, it's a very simple form that can be filled out, real basic information that is very flexible and can be used in many different situations.
Okay. What benefits have you found to using the SBAR tool?
It has allowed better communication in between my staff members as well as staff outside of our laboratory.
Okay. Dan, how did staff initially react to using the SBAR tool?
At first they were a little concerned about it. They came around once they started seeing some of the benefits. It makes it so they only have to do their work one time, and it's very simply communicated to the next person.
Dan, do you plan on expanding the use of the SBAR in your departments?
Yes, I think we will. We've found a specific situation where we use the same SBAR over and over and over again. So we're going to make one very specific to that, so it makes that process go a little bit quicker, and it's very specific to, so the people receiving it will know exactly what they're getting.
So Dan, would you say that the SBAR tool that you started with is really a living and breathing document and very adaptable?
Absolutely. The one we primarily use is very basic and very simple, can be used for many situations. We are making more specific ones for different situations, and they're very simple to change, and you can adapt them very easily.
Thanks a lot, Dan.
Thank you.
Hi, I'm Katie, and I'm here today with Sophia, and she's going to talk to us about collection SBARs and how they are useful for her when she is up on a patient care unit and has something that she needs to communicate with the nursing staff about a problem about collection. Now, Sophia, you've worked at multiple hospitals during your career, and you have experienced many different collection challenges and had to communicate with the patient care units. Can you tell us a little bit about SBAR, which is used here, how you use the form, and how it helps you communicate with the patient care units?
Yes, I can tell you that, definitely. This is the SBAR, and this SBAR, I love it. It's my best friend. Like this SBAR, like let's say for example, when I go up to draw and stat on the floor, anywhere, and for example, if the patient is not in the room, or the patient is busy, or is getting an x-ray done, or EKG or anything like that, you just come out and you find out the nurse, and then you tell the nurse what the problem is or why you couldn't draw the patient's blood right now. And the nurse will tell you, come back later or wait 5 minutes because it's a stat. Then if the nurse says come back later, then what we do is we take a little peon and then we put it right on here. And then you put your name on there, and then the time, and then the nurse that you spoke with. And then the next page, you do the same thing. You put another peon there, and then you give this, the yellow copy, to the nurse. You leave it on the desk, and then you come back to the labs. And then in that case, and later on, if you leave the shift or if you get busy with something else, the next person up will know exactly what's going on, and then they can go back anytime to draw that patient.
It sounds like the SBAR is very helpful for nursing staff. So if they're left with a yellow copy, they can understand why a draw wasn't done. But how does it help the laboratory? What scenarios or questions would you have in the laboratory that you could answer from your white copy?
Well, let's say some other person went there to draw the patient and they were not able to draw it. So later on when the doctor or the nurse calls back, then we know exactly what happened if we have the SBAR, and then we have enough information covering everything, what happened.
Excellent, excellent. It does sound very helpful. So what if there's a miss or something like that? Are you able to tell maybe who missed the draw?
Yes.
Oh, definitely.
If we have the text name and tech code or anything on there, yes.
Okay, great. What if a draw comes down and for some reason maybe the patient's already taken their medication and they don't want the draw anymore? Would they still use the SBAR to communicate that?
Yes, they will still use the SBAR indicating that this patient had the medication already, so we have to cancel this draw, this particular draw right now, and then reorder it for later, or the nurse or the doctor will put the orders in later.
Excellent. That does sound very helpful.
Yeah.
Is there anything that you can think of that would improve SBAR?
Well, I will appreciate it if everybody will use the SBAR. If they use it, to make sure that you put your name and then the person that you spoke with and then the time that you went there.
Okay, so
Yes.
filling out the SBAR and
The
doing it
filling,
properly
yes, yes.
makes it the most
Yes,
useful tool.
yes, yes.
Well, great. Thank you so much,
You're
Sophia,
welcome.
for explaining Collection
No
SBAR
problem.
to us today.